How y'all doing?
Hey guys, welcome back.
It's another week and we survived the week. My voice almost didn't survive this week,
Right,
but
barely.
we are here.
Yes, we are here. We've been
Yes,
busy with
we've
life.
been busy.
We've been
Yes.
busy with life, but now it's time to get back into our topics.
Yes.
Something that we all have experienced.
Of course.
And sometimes
Of
we can
course.
have trouble with them. Sometimes they're easy peasy, but we want to talk about menstruation.
Yes, menstrual cycles. Some people know it as their period, that time of the month. All the things, all the terms we use to describe.
Sister Flo.
Yes, sister
Cousin-
Flo.
cousin Flo.
Yes. All the things depending on, no matter what our culture or background is, if you have a uterus, you are having this once a month.
All right, now I want to talk about the elephant in the room. too.
Yes. What's going on?
Dr. Coates. What's wrong with your voice?
Well, I just want y'all to know that this is an example of how much I love you all and how dedicated I am to this platform and to connect with you all because it took a lot of tea, a lot of hot tea to get me here back to this place. So last weekend,
Yes.
I went to celebrate my best friend, my first HBCU graduation.
Lord.
And this is the outcome.
Yes.
I was hooping and hollering and forgot I had to still show up to work the next day. So yeah, that's what happened.
Sounds like a great time.
It was a really good time.
Sounds like a beautiful time.
Yes. So bear with me. I won't sound like this all the time, but this is just an example of my dedication to you all.
Very good.
Yes.
Well, thank you. We appreciate you showing up.
Yes. So if I go in and out, I'm gonna come back.
Okay. So now back to our topic
Yes.
on menstruation. And we want to get a little personal, talking about our own experience, our experience within our families, maybe with our daughters. I started menstruating at 12. How about you?
I was 10 years old in the 5th grade.
Wow.
And I also passed this on to my daughter.
Yeah.
Unfortunately. Yes.
Did you know what was happening?
No.
Okay.
So my mom tried to prepare me.
Yeah.
She said, your body's going to start changing. We're going to have the conversation after it happens. But we didn't get prepared on the front end. And that's one thing that I wish would have happened.
Absolutely.
It was 9/11 when I started my cycle.
No way.
It was 9/11.
Oh my gosh.
The atmosphere was crazy around us, obviously. And so I just was like, this is a sad time. This is horrible. What is
Yeah.
happening? Not knowing all the things as a 10-year-old, what was
Yeah.
going on at
Right.
the time,
Because a lot of people were crying that
Yes,
day, and you probably
yes.
felt like, my uterus is crying too.
Yes,
What is
it
this
was-
coming out of me?
And nobody else in my classroom was going through this.
Yes.
So I just remember it being traumatic. That's what I would describe it as. It's traumatic.
Yes. And so
Yes.
we try our best to prepare young people so
Yes.
that they don't feel traumatized by it. It's nothing to be afraid
agree.
of. It's nothing to be ashamed of. And so it's important to prepare.
Yes.
And I started menstruating at age 12, and I had 2 older sisters. So I already knew it was coming. I already knew like it wasn't necessarily a fun thing. But when I got it, I was like, oh, I have it now. But
Yes.
then like that cycle, I was like, nah. I wasn't that excited because I guess my sisters were not very happy with their periods. So
See, I grew up in a home with older brothers. I was the only girl. So that's kind of
Yeah.
what to that.
well, my other experience, I will say, is that when Nia wanted to start menstruating, my daughter, all her friends had already started menstruating at school. And she was just like, Mom, why don't I have my period? She would cry and would want her period. Damn! I feel like I spend so much time in the office meeting women who are traumatized by their periods.
Yes.
They have fibroids, they pass clots,
Yes.
their periods last 3 weeks, and that's the mode I'm in.
Yes.
Periods are difficult for a lot of people, and I'm usually trying to fix them.
Yes.
So when my daughter was like, why haven't I had my period? I want my period. It's going to mean so much to me. It means I'm going to become a woman. And I'm just like, what is this talk about
Right.
periods being welcomed?
Right.
And so it really helped me change my perspective. Like, it is a wonderful thing sometimes for people to menstruate. Not everybody suffers from their period. So it was a nice perspective to hear someone be
Looking
joyous.
forward to it.
Looking forward to it.
Yes. So I told you about my experience. I had older brothers. I did not, my mom, told me it's going to come, but I wasn't prepared. Kamaria, my daughter, she was the opposite. She had me in the house, my mom in the house, my little sister in the house. So she was ready for it.
Yes.
I passed the curse on to her. I call it a curse still, you all, even though we're talking about looking forward to it. See, I'm still, precipitating that attitude. But I passed it on to her. She started her period when she was 10 years old in the 5th grade. She called me at work. I was a resident doctor working overnight.
Hey, if you like what you see, hit that subscribe, hit that like. It will allow us to bring you more content so we can keep bringing it and you can keep enjoying it. So let's get back to this episode.
She called me and said, Mom, I just started my period. Yes. I've taken my 800 milligrams of ibuprofen. I put on the pad.
What?
I got a heating pad on my belly.
Love it.
I don't want you to worry. And I just had tears falling down my face. And she's like, I'm good. And my mom's in the background says, she's resting. She's good. And I was like, who are you?
Yeah.
Like, she was so prepared for it. And I love that. So after work, I went and got her a calendar so she can start marking her cycles.
That's cool.
Teddy bear, chocolates. Because I wanted this to be a moment she celebrate.
Absolutely.
You are coming into a new phase of your life. You're maturing. And so I made it a whole moment. And I like the idea that our girls, they look forward to things like this because I did not have that attitude.
Absolutely. We spent a lot of time beforehand because we talked so much about this period that was never coming, she thought. Making a little bag with another pair of pants, panties, a pad.
Yes.
So a little kit for her to take and put in her locker. It was so cute.
To be prepared.
Yes.
I think that's really important too for our listeners because even if you are not comfortable talking to your child about it, you may not have had the best experience, or you may be a dad or raising a child and you don't know what to expect. You can bring them to their gynecologist. Yeah. You can bring them to their primary care physician, their pediatrician, so they can start having these conversations about what to expect, what's normal, when it's supposed to start, so that they can have a better outlook and be prepared. And it doesn't sneak up on them.
Absolutely. Yes, it can be a joyous thing.
It can be. Absolutely. And I know coming from us, as we're trying to fix everyone who's having a bad experience with the cycle, we do talk about what you can buy ahead of time at appointments. We talk about medications that you can have on board so we can have all those things in place so that it doesn't sneak up on you.
Okay, so now with menstruation, a lot of people don't understand the difference that there's menstruation and there's cycles.
Yes.
So menstruation is the actual blood flow.
Correct.
Okay. Cycle is the time from the start of one period to the start of the next period. And that could be anywhere between 21 to 35 days.
Correct.
So what is the purpose of a period? What do you tell your patients?
Yes. I tell patients that the purpose of a period is to reset. It's your body flushing itself because you did not get pregnant.
Right.
The uterus is an organ that is made to house a fetus. And at that point, you did not utilize it for that cycle that we're talking about. So now your body is resetting to start over. It is that flushing moment, that restart moment for that next cycle to occur to see if your body is going to attempt pregnancy in that next period.
And we have some women who absolutely hate their periods.
Yes.
They dread this reset
Yes.
every month. But there are some women I've spoken to that are like, I love feeling that sensation of resetting and starting anew. And so that's why some women really love having a menstruation every month.
Yes. And I think that helps us in our counseling because I ask women, do you want to have a menstrual cycle? Especially when we're talking about birth control options, which will affect their menstrual cycle. Because some women, they're like culturally or just for their own sake, I want my body to have that moment.
Yes.
And so we don't want to give things or offer things to them that will take that away.
That is such an important point because we don't get to decide what is good or what is right for a person. And asking from the start, What are your goals?
Yes.
Are you
Yes.
happy with your menstruation? Is it too long? Is it too heavy? Do you want one at all?
Yes.
I think that's a good place to start.
Yes. And one of the common questions we get is, what is too much? Like, what is too much when we're expecting in a menstrual cycle during menses? And it's that woman's perspective.
Absolutely.
Like, it's our perspective if we feel like it is causing too much distress, how much bleeding we're having. So I feel like we also have to take that into account.
Absolutely. And I think what's important to know is like, why does a menstruation happen? You talk about you get reset because you don't get pregnant, but it is a very delicate circular communication of hormones from the brain to the ovaries and to the uterus.
Yes.
And this happens throughout your cycle. And you get those signals that will tell your body, you did not get pregnant this month. It is now time to shed this lining. Now, when you have irregular periods, that means that cycle of signals are not working.
Correct.
They are not sending the
Correct.
right signals to the right spots.
Yes. And we don't know sometimes where that breakdown in communication can occur. Because as
Absolutely.
Dr. Franklin was saying, that can be a breakdown from the brain to the ovaries, from the ovaries to the uterus. It could be an anatomy issue. You know, there's some genetic disorders where sometimes we don't know until it's time to have that menstrual cycle that there may be some organs that are missing. That happens rarely, or but that could happen. And that's why it's important, if you feel like there's something off with your cycles, to don't wait too late to come have that conversation with your gynecologist so that we can start to assess where the irregularity is coming from.
This is such a good point too, because I have some women that say my cycle is every 28 days.
Yes.
And this month it was 27 days.
Yes.
And I'm like, I get it.
Yes.
I know you are, by the book.
Right.
You have a cycle, but there is some variation that's allowed.
And you know what? I asked him, I said, what happened in the last month?
Uh-huh.
Did we start a new job?
Yes.
Did we, is the test time at school? You know, did you take a new medication?
That's
Were you
right.
on antibiotics for a UTI?
Absolutely. And people don't realize those social factors, these physical, emotional changes can definitely impact your cycle.
Yeah.
So you mentioned some already. We've got stress that can be
Yes.
caused. So you've been up studying for your test.
Yes.
You've been pulling all-nighters. So you're not sleeping well. Your sleep cycle's off. You're getting some stress, and that can throw you off for sure.
Absolutely.
Some other things, changes in your weight.
Of course, yes.
Yeah, gaining weight, losing weight can cause that.
Yeah.
We talked about sleep cycle and
Medications is a big one.
Medications.
We have a lot of our patients who may be starting a new medication, like an antidepressant, a medicine for our mood, for anxiety or depression. And those things can affect our cycles, and we get a little bit thrown off by it. No one educated us about it, but those things can affect us.
Yes.
So all of those things can play a role.
yes,
I also tell my patients, it's funny, I say, unfortunately, how the universe works, right? Our reproductive systems kind of gets like the end of us.
Yes.
Like when we're going through a stressful moment, our body is kind of like, we're not at a place where we need to reproduce, right?
Yeah.
Because our cycle is about reproducing and trying to get pregnant. And so sometimes our body's like, we can hold off on this at this moment, and that can lead to that irregularity in menses.
absolutely. You mentioned some structural things. Certainly, one of the most common things we rule out when someone comes in with irregular periods is whether or not they have fibroids. Do they
Yes.
have a polyp in their uterus?
Yes.
And so ultrasound is going to be a way to detect some of those things.
Absolutely.
And of course, our mindset is that you come in with irregular bleeding and you're of a certain age group, it is cancer until proven otherwise. So, many times we are doing biopsies of the inside of the uterus to ensure that it is a benign condition that can be managed in an appropriate fashion and does not have to be moved immediately to surgery.
Yeah. And, we will get into a lot of the irregularities of menstrual cycles, because we have some women who's going to have heavy bleeding, longer cycles. We have another group of women who have periods where they don't bleed. And we call that amenorrhea, going a longer period, 3 months or more without a cycle. And so when you come to us about these things, we're going to utilize a lot of components like ultrasound,
Yes.
like laboratory evaluation to look
Absolutely.
at hormone levels. Also lifestyle, right? Exercise, things like that can affect how we menstruate, our eating habits. So we're going to utilize that history and that workup to determine what in that cycle that you were describing from the brain, the ovaries to the uterus, it's being missing or being skipped that is causing it irregularities.
Absolutely.
Yeah.
Sometimes I'm meeting a woman for the first time and she's going through how her periods are very irregular and she's not happy with them. And I'm getting all these questions answered. And then, after a conversation, and I'm on a birth control method.
Yes, and
and I'm like, oh, that's
we
probably the
should
reason.
start
We should have started
Yes.
there.
I'm like, the next one, ma'am, you should have told me that when you walked in the door.
Exactly, because she could have missed a couple pills
Yes,
and that threw her
yes,
cycle off.
yes.
There are some birth controls that in the start of those, you can have some irregular cycles until your body adjusts to it and the uterine lining thins. And that could be a normal expectation with that type of birth control.
Absolutely. One of the other things that a lot of people don't talk about as much is how our cycles will change as we age.
That's true.
Right? Some of that irregularity will happen as we're starting to reach that stage of menopause. And that can start as early as 5 to 10 years before menopause. So for those of you who don't know, menopause occurs when we have no bleeding for 12 months.
Yes.
And some women can have irregular cycles years prior to getting to that stage.
Yes.
And it freaks them out a little bit because they've been regular forever. And now out of nowhere, there's been this change where their periods look different. And so we often have to start having that conversation of things to look out for so that they can know what to expect in the future.
And if you are experiencing that, that's why it is so important to see a doctor, because in our minds, when someone comes to see us at a certain age group, it is cancer until proven otherwise. Otherwise, you cannot bank, it's just perimenopause, I'm just going to ride this out. No, you need to be evaluated.
Yes, I agree. We talk about evaluating for abnormal cycles. When you have young women who come to you,
Yes.
especially like their first couple periods, what do you tell them? Because that's a little bit different, and a lot of young women don't know. So I'm talking about those women that first year of starting their menstrual cycle.
Well, it's just normal for them to have irregular cycles. Their ovaries are still trying to figure it out. And so they don't have a very regular pattern of hormonal exposure from the ovaries. And so it can be normal to be irregular in the first year.
Yeah. I think a lot of people, young people that I see, they get really freaked out because the first 3 months they had their period and things were normal, or their cycle, their menstrual cycle, I'm trying to use the correct words.
Yes.
And everything was normal. It was coming every 28 days, lasting for 3 to 5 days. And then there was a change and they're thinking, I'm broken. And I'm like, no, this is your body trying to find what your normal is. That first year of starting your cycle, there's going to be some irregularity. And so in the beginning of your cycles, you may experience some irregular cycles. And as our cycles start to end, as we come in close to menopause, you will experience those irregular cycles.
I will say, young people that come in with irregular bleeding as well, that is not the group I'm concerned about uterine cancer.
Yes.
I am thinking pregnancy. I need to rule out pregnancy, because some people say, oh, I kept having periods and I didn't realize I was 3 months pregnant. Well, it could have just been bleeding from the pregnancy.
Yes.
You can have bleeding in pregnancy from a subchorionic hemorrhage, which can happen, and you assume it's a period, but it's just bleeding through early pregnancy. So we always rule out pregnancy. That could be on the top of our list that we're concerned about. The other thing is infection. Can cause you to have irregular bleeding between your periods. You may have spotting and bleeding because gonorrhea and chlamydia are cervicitis infections. They infect the cervix, and the cervix can bleed when there's an infection there.
Of course. Yeah. Another part of it is hormonal changes. So I know we don't always think about cancer in our young population that has irregular bleeding, but we do have certain conditions, and I know we're going to have to do a separate episode on polycystic ovarian syndrome. But some young women who may have more adipose tissue or fatty tissue, they have more estrogen.
Yes.
Estrogen is the hormone that stimulates our uterus to make the tissue that we're going to menstruate every month. And that can lead to irregular bleeding, and that can put you at risk for things like early cancer in your uterus. Yes. And so sometimes we ruling out infection. Sometimes we're also ruling out a early pre-cancer in your uterus for young women who has symptoms associated with polycystic ovarian syndrome. So we often think about our older women, but that younger population, depending on how long your bleeding has been irregular, what other risk factors you may have, for example, obesity, then that could lead to things like a biopsy of your uterus to rule out a cancer or a precancer.
The other thing I will say that you brought up a good point, young person, risk of cancer, cervical cancer.
Yes.
So this is important because I know there was a recent case.
Yes.
A young lady had gone to the emergency room, had a delayed diagnosis. That is something you've got to think about in a young person. People that are sexually active can be exposed to HPV, the human papillomavirus, and that can cause cervical cancer. And so when you come in with irregular bleeding in pregnancy test, you need to rule out. And you need to definitely rule out infection. You also need to be ruling out risk of cervical cancer for those people because they'll have irregular bleeding as well.
Yeah, I agree. I don't know if you checked out our episode, but we did an episode on pap smears, HPV, and cervical cancer. So if you missed that one, go back and watch it because we talked about when it's important to start screening for those things. But as Dr. Franklin was saying, sometimes we need to screen earlier in women who are having irregular bleeding.
Absolutely.
Yeah. What's up, y'all? Thanks so much for watching this episode. Stop what you're doing right now to not only subscribe, like, as well as comment so that we can bring you more episodes like this with topics of your choice. We'll see y'all soon.